So politicians love to fight about these process things, but I think it's a cliche that nobody really cares. What people care about is what's going to be in the actual bill. So what, if anything, do we know?
Joe, there's not a lot we know for sure in terms of what's going to be in the final bill, but tomorrow, Senate Republican leaders are expected to release what they're calling a discussion draft that'll be the basis of legislation coming up for a vote, ideally next Thursday, they say. We don't know specifically what's going to be in the bill, but here's what we do know. They're aiming to make it look more like the House version of the AHCA than not. It's going to be major cuts and reforms to Medicaid, capping the amount that it spends on individuals, potentially even having an option for states to do a block grant, which means they just get a lump sum of money and they can spend it on Medicaid however they want. It's also likely to include state waivers for some of Obamacare's regulations, including things like essential health benefits. That's according to Senator Tom Tillis, a North Carolina Republican I spoke to just days ago. Unanswered questions include what it's going to do about community rating, the provision that insurance companies cannot charge people more based on their health status. The House bill weakened that. And we also don't know what exactly it's going to do on Planned Parenthood, if it's going to defund that. That's a problem for some Republican senators, including Susan Collins and Lisa Murkowski. Joe.
It's quite fascinating. This is the best kept secret in Washington, which says something. I've got two questions, Sahil, on this. The first is, does the secrecy help those Republicans that would face pressure from voters back home? If there is a vote on it next week, there's a very narrow window for them to come under any kind of pressure. And then my second question is a bit more straightforward. Who's actually writing this bill? Because I've seen comments from some of those supposed 13 members of the working group suggesting that they haven't seen this either. So who's actually doing this?
Julia, your second question is a lot easier. It's Senator McConnell, the Republican leader, who's writing this bill. He's keeping his cards very close to the vest, and he has centralized this process in a way that, he's pretty much running this thing top to bottom. There are members, as you point out, of that 13-member working group, including Senator Mike Lee, who said just yesterday in a video he posted to Facebook that he has not seen the bill. So that just gives you an idea of how secretive it is. Now, look, in terms of what they have to lose, there's a cost to doing things any which way. If this was an open process, if they're deliberating these things in the light of day, then they would be getting reams of criticism from just about every industry group who would have something to lose by taking all this money out of the healthcare economy, by all these cuts to Medicaid, and you have groups like the American Medical Association who are opposed to these cuts as well. So there would be a cost to that. Now, Senator McConnell doesn't do anything by accident. He's a very, very strategic legislator. He has decided, it seems to me, that doing this quietly and secretly would be more beneficial, would have fewer political drawbacks than doing this out in the open. And we'll probably find out in the next few days, but it's going to be probably a very close vote and in some ways a tough slog for him to get to 50, but I wouldn't count him out on that.